Okay, so good morning to all of my dear friends and students. आज की क्लास में हम लोग क्या पढ़ेंगे? आज की क्लास में हम लोग पढ़ेंगे हेडेक के बारे में। कौन से टेक्स्ट बुक से? हैरिसन से। आज की क्लास में हम लोग हैरिसन पढ़ेंगे। हाँ, हैरिसन पढ़ेंगे। कौन सा टॉपिक है? हेडेक है। तो सबसे पहले हम ये जानेंगे कि हेडेक होता क्या है। So headache is basically a unpleasant sensation. In common language, we can say that it is a unpleasant sensation that you feel over the cranium. So headache एक तरह का unpleasant sensation होता है जो कि आप अपने cranium region के ऊपर आप feel करते हैं. Now the question is arise, how these headaches will origin. What are the origin? How this headache will originated? So basically, what happens? There are some pain receptors. There are some pain receptors not in the brain parenchyma. The pain receptors are located either in outside the cranium or some pain receptors are also present inside the cranium. So there are pain receptors. Some pain receptors are present outside the cranium, at the scalp region. Some pain receptors are present in meninges, dura mater, and some other places. So what happens whenever any external things are happening inside the cranium cavity? So these external things activate the pain receptor that are located in the cranium region. So what are the external things that are happening in the cranium that stimulate the pain receptors? So these external things are either a brain become edematous, or the cerebral blood vessels undergoes vasodilation, or there is the increased intracranial pressure. So what I am telling to you, 2-3 things are common that are happening inside the cranium that leads to the headaches. One the common things is that brain parenchyma become edematous. Other things is that vasodilation, कौन सा? सेरिब्रल ब्लड वेसल्स. Third things is that the rise intracranial pressure. So if any of these things are happening, that stimulates the intracranial or the extracranial pain receptor. Generally there are no pain receptors in the brain parenchyma, but the pain receptors are located inside the cranium or outside the cranium and in a scalp region. So when due to the brain parenchyma become edematous, or there is the cerebral vasodilation or increase the intracranial pressure, that stimulate the pain receptors. So when the pain receptor get stimulated, you feel headaches. So these are the process through which the pain is originated and you experience pain as a headache. So now there are two types of the headache. We classify headaches into the two types. One is the primary headache. And the another is the secondary headache. On the basis of its characteristics of the feature, we basically classify headaches into the two categories. One is the primary headaches, and the another is secondary headache. So what are the difference between this primary headache and the secondary headache? In case of the primary headaches, the headache is itself act as a disorder. In case of secondary headaches, the headache is not act as a itself act as a disorder, there is some exogenous cause behind it, and in secondary headaches, the headache is act as a symptom. So what I am telling to you, in primary headache, the headache is itself act as disorder. There is no any exogenous cause behind this primary headache. But in case of the secondary headache, this headache is produced as a symptoms of exogenous disorder. Here headache is a symptoms, and the cause of headache is exogenous disorder. So what are the exogenous disorder? Common exogenous disorder is meningitis, any viral fever, or vasculitis disorder, and so many other things. In common things we say only two things. First thing is that in primary headache, the headache is itself act as a disorder. There is no any exogenous cause behind it. While in case of the secondary headaches, here headache is a symptoms of the exogenous cause. Exogenous cause may be meningitis, vasculitis, any acute febrile illness, and so many other things. So when any patient come to the OPD and having a complaint of headaches, we first rule out these secondary cause. Because if you not rule out this secondary cause and treat this patient as a primary headaches, in long period there is the worsening of the condition, and if the condition are more worsened, then it is difficult to treat that patient. So that's why whenever a patient come to our OPD and they having a complaint of headache, we first rule out the exogenous cause as a secondary headache, and then we go for the primary headache. So the now question is arise, how we rule out a patient having a secondary headaches or not. So for rule out a patient having the secondary headaches or not, we use red flag sign. So now we are going to discuss about what is the red flag sign. What is the red flag sign? Okay. Red flag sign, R-E-D, red, F-L-A-G, flag, S-I-G-N, red flag sign. One of the common red flag sign is age. Age means what age? Age greater than 60 years. Why we consider age 16 years as a red flag sign? Because in age less than 50 years or a medieval age, there is high workload pressure. So due to the high workload pressure, the patient having a headache. So if a patient whose age is less than 60 years, younger population, and they complain of headaches, we think that they have been headache due to the high workload, and we consider it as a primary headache. But after the 16 year, generally the person get retired, and they freely sitting in his homes and enjoy whatever the life they left. So at age above the 60 year, we can't think about that a patient having a high workload. So if a patient age more than 16 year and they complain of headaches, our first diagnosis is we think about that it is a secondary headache. The other things is that if any patient having a hypertension, or bradycardia, hypertension, bradycardia, or what? Hypertension, bradycardia, or a projectile vomiting. So if any patient having either hypertension, bradycardia and the projectile vomiting, then we again think about it is a secondary headache. And if all three symptoms, if any patient come to the OPD and they complain all three symptoms, they are highly suggestive of increased intracranial pressure. So if there is an increased intracranial pressure and patient having the patient having the projectile vomiting, bradycardia and the hypertension, these things are not commonly seen in case of the primary headache. They are exclusively for the secondary headaches. Here we like to discuss the word projectile vomiting. So what is the projectile vomiting? According to this word, when we know the meaning of a projectile motion, that means some things are moving away from one place to another place, like a projectile motion. So what happens in case of the projectile vomitings? The patient vomitous materials are moving away from him. Let's suppose if I am a patient and I undergo the projectile vomiting, then my vomitous materials are thrown away from me. If someone clinician are standing in front of me, then having higher possibility that these vomitous materials are fall on them. But in case of the non-projectile vomitings, the vomitous materials are falls on the patient body itself. So now the question is arise, why in case of the projectile vomitings there is a projectile movement of this vomitous, or in case of the non-projectile vomitings there is no any projectile motion? The answer behind it is, in case of the projectile vomitings, here there is no any abdominal discomfort. We commonly call it a nausea. Now before vomiting. So what happened? Patients are talking with clinician, and since they having no any pre-nausea, then they suddenly start vomits. They are not well prepared for the vomiting. But in case of the non-projectile vomitings, there is a pre-symptoms of nausea. So the patient are already know that after in few minutes I undergo the vomiting condition. So they are they are already pre-prepared before the vomiting. So in this condition, since they are already pre-prepared, so there is less chance that they vomits material to some other person body. So these are basically the difference of the projectile vomiting from the non-projectile vomiting. Some other features are also a patient having a feature what? Acute fever. If a patient having a fever, it is highly suggestive that a patient having a infection. Either a patient having an infection or having a meningitis. So how we differentiate a patient having a meningitis or having a common viral illness? So we do a simple neck test. We ask patient to touch his chin to his chest. If during this process they feel ill due to the neck stiffness, we think about that patient having a meningitis. But if he having any complaint of pain, then it is a acute febrile, a fever. So these are the common red flag signs. On this basis we differentiate primary headaches from the secondary headaches. Now we go for the primary headaches. So how we differentiate primary headaches? There are several types of primary headaches. We like to discuss two of them. One is the migraine, and the other is tension type headache. So we basically discuss, one is the migraine and the other is tension type headache. Tension type headache. Tension type headache. Okay. So in migraine, the patient complain they having a pain, I mean headache, moderate to severe, moderate to severe. While in case of the tension type, the headache is mild to moderate. Headache is mild to moderate. Other things is that migraine it lasts for 4 to 72 hours, but this tension type headaches it takes 1 week or more than 1 week. So if patient come to the OPD, they having complaint that they having a headache, but it is around 1 to 2 days. So if a patient having complaint of headaches around hour to days not longer than 1 week or 10 days, it is last hardly for 2 to 3 days, then we think about a patient having a migraine. But if a patient complain that they having a mild headaches, but it is since 10 days 15 days, then here we can't think about it is a migraine. It is a feature of tension type headaches. So these are the two features. One is that they having a moderate to severe pain. Here the pain is mild to moderate, lasts for 4 to 72 hours, and it is lasting for the 1 week or more than 1 week. The other classical feature is the migraine is the unilateral and the tension type is the bilateral. Okay, unilateral means patient complain that they having a pain on one side of the head, while if a patient complain that they having pain in both side of the head, then we think about it is a tension type headaches. And if a patient complain that they having a pain is unilateral, that means only one side of the head, we think about it is a migraine. The other feature is that in case of migraine, patient having a photophobia and phonophobia. Okay, so what is the meaning of photophobia? Photophobia means intolerance to the bright light, and phonophobia means intolerance to the loud sounds. So if patient complain that there is worsening of headaches when they go in bright sunlight or they heard a loud sounds, then we think about it is a migraine. But when these symptoms are not associated in case of tension types headaches. Other things is that patient in some patient there is a presence of aura. Here no aura are present. Aura means it is a abnormal sensory perception. It is abnormal sensory perception. It may be auditory, it may be visual. Patient complain that before the starting of headaches, they feel some floater, some zigzag lines, some brightening lights. So if a patient complain of some visual or some auditory complaint, I mean what? They complain of abnormal sensory perception, but in case of tension type headaches, they have no any such types of complaint. So on this basis, we classify a patient having a migraine or the tension types headaches. So here we bind up the session. Your again fresh welcomes in next lecture. Okay, thank you.